Hi, my name is Harleen, and I'm here with Leadership Initiatives today. How are you doing today?
Hello, Harleen. I'm Dr. Hamza Yusuf. I'm from northeastern part of Nigeria, and I'm going to be helping you to make your diagnosis, okay?
Okay.
Right. I'm going to switch the camera. You should be able to see your patient and
Okay.
ask all the questions that you want to ask, okay?
Okay. Hi, once again, my name is Harleen, and I'm with Leadership Initiatives today. What is your name?
Okay. She said her name is Helen, and she's from Leadership Initiatives. She's asking, what is your name? Okay. His name is John Oga, and he's 28 years old.
Okay, perfect. And are you married?
Are you married? He's not married.
Okay.
Yeah.
So, how are you feeling today? What's wrong?
So she said, how are you feeling today and what is wrong? All right. He's been having this fever uh, and with associated joint pain and abdominal pain for the past 1 week.
Okay. So about your fever, is your fever getting worse as time goes on, or does it come and go? Like sometimes it's there, sometimes it's not there.
Okay. Wai wannan zazzabin da kake samu ko yana like was it getting worse from misali a ce yau na jiya na yau ya fi na jiya ka gane haka ne? Okay. Ko kuma yana zuwa ya je ya dawo ne. At any time of the day da ya fi yawa? Okay. Okay. He said the fever has actually been intermittent and it's usually worse in the evening hours, but it has worsened over the days. Like today's fever is greater than the one yesterday and so forth.
Okay, but it is intermittent, like it's worse at night than it is in the morning.
Yes, exactly.
Okay, and about the abdominal pain, is there any vomiting? Is there any diarrhea associated with the abdominal pain as well?
Wai akwai amai ne? Ba amai. Akwai any diarrhea ko constipation? Hmm? Mm. Okay. Okay. He actually has some diarrhea associated with the abdominal pain, but there's no vomiting or constipation.
Okay. So, are you feeling any cough, any sore throat, or no?
Okay, when you cough, ko sore throat, ko wani abu? Oh, he doesn't have any cough or sore throat.
Okay, perfect. So there's only diarrhea. And would you
Yes.
say that there's a headache? Does the patient have a headache?
Yes, he does have a headache.
Okay. About the question, is your headache getting worse? Like, is it a very bad headache or not really?
When headache and nata, is it is it very come out on a scale of 1 to 10? No, like about just five? Okay. 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 Oh, okay. Um, he will give it a 5 out of 10 for the headache. Yeah.
Okay. Are you having any difficulty concentrating?
Ray, do you have any difficulty concentrating ko kuma wani abu? Okay, he doesn't have any difficulty in concentrating.
Okay. And any dizziness?
Do you feel dizzy? Yes, he does have some dizziness.
Okay.
Yeah.
Okay. And for what is your diet like at home?
Like a gida, many mostly kakichi. Okay, no? Okay, come on. So Amara, do you have a lot of meat? Okay, mostly. Vegetables, sir. Okay. His mainly his diet consists of rice and pasta and with some fish and sometimes egg, but he doesn't usually have a lot of red meat. And sometimes he also has some vegetables.
Okay. And are you craving any ice or sand or any non-edible item?
Wai kana cin wani abu ne kaman kana ji kaman ka ci ƙasa ko wani abu haka? No, he doesn't have any odd cravings as such.
Okay. Uh, does the patient live near any still water in the area?
Wai kaman a unguwan ko gidanku akwai irin kamar ruwa wanda baya gudu ne haka ko wani abu? Um, okay, okay. He doesn't have any stagnant water in his house, and there are also no bushes around his home.
Okay. In the area that you live in, are there a lot of mosquitoes?
Kamar akwai sauro sosai ne a yeah, there are a lot of mosquitoes actually.
And do you remember being bitten recently?
Wai kamar ka ji kamar sauro ya cije ka ne recently? Mhm. Yeah, he was actually bitten by mosquitoes.
Okay. And for the abdominal pain, would the patient say that the diarrhea is very bad, that it's disruptive to the life, or is it did it just happen once, or is it happening all the time?
Kuma wannan kaman gudawan nan, ko? Is it all the time ko just once ne kake hannu? Eh? Kaman wannan loose ko wani abu haka. Is it just okay. He had it just like 2 or 3 times and it has not been getting worse.
Okay. Um, is the abdominal pain still there? Or
Har yanzu akwai ciwon ciki? Okay, the abdominal pain have actually subsided.
okay. Um,
Would you like to know
uh,
anything about some of the investigations that we've had?
yes, give me, okay, I have one more question just quickly.
Okay.
Does the patient have any fever? It comes and goes, the intermittent fever. Has the patient taken any antipyretics for the fever already?
Okay. Wai wannan zazzabin da kake yi, ka sha kamar su wani ko paracetamol ne ko nawa a gida akai? Okay. Yes, he actually took an antipyretic, paracetamol.
And so so you said that the fever was intermittent, so it came and goes. Did it also come and go before you took the antipyretic, or was this just something you noticed after the medicine?
So wai wannan fever da ya sauka din, is it after ka sha maganin ne ya sauka? Ko kuma tun kafin ka sha maganin paracetamol ɗin da ma fever yana tafiya ya je ya dawo? Okay. He The fever has actually been intermittent even before he had the antipyretic.
Okay.
Yeah.
So I would like to inquire about any rapid diagnostic tests for malaria that has happened that you have taken.
Yes. we actually did a rapid diagnostic test. We did a blood film that showed
Mhm.
2 pluses of malaria parasite.
2 plus.
Yeah, 2 pluses.
Okay.
We also did a complete blood count that
Yes,
showed
I was just gonna
a okay. We also did a complete blood count that showed a hemoglobin count of 10 gram per deciliter.
Okay, 10 gram. Okay, so the good news is that your hemoglobin is normal, so that's good. But um, so since your rapid diagnostic test for malaria did come back as 2 plus, that means we do have malaria. Was there any blood culture that was taken for typhoid bacteria?
Yes, we took the samples today, but the results are going to be out. You know, blood cultures take at least 72 hours before we have the results. But for the Widal test for typhoid fever, also turned out positive.
Okay, so I would like to diagnose the patient with malaria as well as typhoid fever.
Perfect.
And so for the malaria, I would like to prescribe ACT.
Okay.
And I recommend to help prevent this happening in the future that the patient tries to kill the mosquitoes with their hand, tries to sleep under a mosquito net to help avoid getting bitten. And for the typhoid fever, I'm going to prescribe some antibiotics. And I know that you've already been taking antipyretics, so I'm going to encourage you to keep taking the antibiotics until your fever is gone. And in order to avoid catching thyroid fever in the future, I recommend that you wash your hands. And before you have any drinking water, try to boil the water that you're using in the household to wash dishes, to drink, just to help prevent catching it again.
Oh, wai tana so ta ce maka tana tunanin kamar tana da malaria da typhoid fever, and she is going to prescribe ACT for you for the malaria and some antibiotics for the typhoid fever. And she should also keep on taking the paracetamol just for the fever until fever enough. And in order to prevent haka from faruwa, you should be using mosquito nets. Sannan kuma a kashe mosquitoes in anytime ana ka gansu. Sannan kuma kake wanke hannunka, especially after using the restroom ko kuma kafin a ci abinci ko kuma abu, sannan you should take also very clean water so that to prevent yourself from typhoid, please. Okay, so I've actually explained everything that you said to your patient, and he's also grateful for everything that you're doing. He's going to comply with all treatment recommendations and preventive measures. So,
Okay.
is there any other thing else you'd like to tell your patient?
In 2 weeks, I recommend that the patient comes back just to make sure that all of the medications that we're giving are working and that the symptoms are either subsiding or improving, because if they're not, then we might have to reevaluate this course of action.
Perfect. So, the way kana so ka dawo in 2 weeks for follow-up, so da mu tabbatar cewa abin da muka bayar yana aiki ko kuma baya aiki ko? And I personally want to commend you, particularly how confident you've been. And even at the end of the session, you were able to you were remain okay. So you were also able to recommend that the patient should come back for follow-up. So that's a plus for you, and congratulations for your performance.
Thank
I I'm going to switch the camera so that you should be able to wave goodbye to your patient. Okay. So like yeah, waving into goodbye. Okay?
Hi. Thank you for everything. I hope you feel better.